Um, Care with a midwife can be very different than care with an OB. And the reason that I say every mother deserves a midwife, and some need an OB too, is because midwives are trained in normal birth, low risk, healthy women. So you wouldn't need an OB unless you uh, developed something during your pregnancy that would make you no longer low risk. And so at that point, a midwife should refer you to an OB. However, most midwives, even if they refer you out, will still continue to be supportive for you and still listen to you and still be there for you because you've developed a relationship with her. The appointments with doing prenatal care with a midwife are typically scheduled uh, in the same fashion that an OB schedule would be. You would see your midwife once a month until 28 weeks, and then every 2 weeks from 28 to 36 weeks, and then from 36 weeks until you give birth, you would see your midwife once a week. The difference is that instead of sitting in a waiting room for a half an hour and then seeing your midwife for 10 or 15 minutes and then being rushed out the door because they have more patients to see. First of all, you're not a patient, you're a client, and you're typically not going to be waiting more than 5 minutes, if that. And your appointment is going to last 45 minutes to an hour. You will have plenty of time to talk about anything that you want to talk about or ask about. Lots of mamas come in with a list, and we love that. We love it when they bring a list and they have stuff, they have questions, and we can discuss all kinds of things. That's a wonderful thing because it builds that relationship, and it also, the moms don't walk out still feeling like, well, you know, they are involved in their care. They're making these decisions. They're growing in their education of childbirth each time. It doesn't matter how many babies you've had, you learn something new with every baby. I've had 3 babies, and I can tell you that each time I learn something new with each pregnancy. Not every pregnancy is the same. They can be very different. And you may have symptoms in one pregnancy that you didn't have in the last one. And so it can take you into a whole other place. And this is where midwifery care really makes a difference in education and connection and really giving you that sense of, one of the things that I really talk about with my clients is, you can say that you want to have a natural birth, and we know that you're low risk and healthy, but you have to take ownership of that. You have to step up and say, I'm going to do everything that I can to keep myself low risk and healthy and to have a healthy natural birth. And midwives can help you do that. And it's an awesome relationship. It's an awesome thing. And I really see so many, we have so many clients that come into care and their last experience was traumatic for them. And midwifery care is very healing for them. And so why do you have to go through the trauma first? I don't see why anyone should have to go through a traumatic birth first before they can reap the benefits of seeking out a midwife and having midwifery care. Midwifery care should be the standard across the board. And every mama deserves a midwife. And if she also needs an OB, then she also needs an OB. But the point is that it's more about just having a physically healthy mom and baby. We want to have emotionally and mentally healthy mom and baby. We want to have a mama that feels connected. We want to have a mama that feels supported. We want her to really bond with her baby and really enjoy the experience of motherhood, because motherhood is a gift and it is a blessing. And so I'm gonna keep doing these videos and share a little by little. So I hope you enjoyed this one, and the next video that I'm planning is going to start my childbirth education series, because I really want to create a place, and this is why one of the reasons I started the channel is to create a place where I can share all of these educational things. It shouldn't be some big secret. Anybody should be able to have a great birth, and the education of it shouldn't be a secret. It should be available to everyone. And so that is my point, and that is my goal. So we're going to talk about everything from taking ownership of keeping yourself low risk and healthy. We're going to talk about birth planning. We're going to talk about the differences in care providers. We're going to talk about different locations of birth and different options for birth. We're going to talk about water birth, and we're going to talk about breech. We're going to talk about how to make sure baby's in a good position for a natural birth. And we're going to talk about postpartum. Postpartum really is one of the areas that gets forgotten. And we have so many moms who just really struggle with postpartum depression and anxiety, and they're not supported. I'm going to be perfectly honest with you. Until I really got familiar with midwifery care, I had no idea what a meal train was. Somebody's going to come over here and wash my clothes. You know, I had 2 babies, and then 3 days later got up and started taking care of household everything, and I was miserable, and I just thought, I gotta suck it up, this is how it is. But the truth is that if you're building a community and you're giving resources to moms and you're really supporting them, they shouldn't be miserable. They shouldn't feel like they have to suck it up and go through this traumatic experience postpartum. It shouldn't be like that. Even if they have unexpected things that arise during their birth and their postpartum healing is unexpected and different than they anticipated, they should still feel supported. They should feel supported in breastfeeding. They should feel supported in healing. And they should feel supported in a community that is going to be there for them. And that's what we need to work on. That's what people are missing the most, is that connection. So this is where we're going to get real. This is where we're going to talk about how we do that and how we get that back for our mamas. How do we get that back for our communities? And how do we build that so that when our children grow up, that's normal. We don't want them to have to fix what we aren't fixing. We want to fix it now. We want to make it better. We want to change the culture. Let's change the culture together.